Thank you for joining us today. This is Jessica Count, Sales and Events Manager with California Hotel and Lodging Association. To start, if there are any media or any reporters on this call, please exit now. This information is not authorized for media usage. And today's presentation will be recorded and posted on our website at calodging.com. On our homepage, as many of you are aware, there is a coronavirus updates and resources section updated daily for you. And this is where you'll find today's recording and some tools we hope you continue to find helpful. And I'd like to say congratulations to our CABI and CHLA members who have been approved as clean and safe certified. We've received inquiries from people who are already planning their future travel in search of clean and safe certified hotels. So in response, we've added a list on our website of over 200 certified properties and do encourage you to submit your checklist, also found on our homepage as well. And for today, on your toolbar, you will see a section referencing to several handouts. You may go ahead and select to download for review, and you'll notice there is a section you can type in to submit any questions during the presentation. We'll go ahead and answer some of the questions for you, and we'll follow up with any remaining questions. And today's update is sponsored by CHLA's partner, Dell. Customers are at the core of everything Dell does. Dell is focused on delivering affordable technology solutions that enable CHLA members to make smarter business decisions wherever you work from. And we partner with Dell to bring you savings on laptops, desktops, servers, security, Dell branded electronics and accessories, and more to add to that. You can reach out directly to our Dell contact for information on how you can take advantage of your member savings, or you can also shop anytime at Dell.com/CHLA. So special thank you to Dell. And again, if there is any media or any reporters on this call, please exit now. This information is not authorized for media usage. And for today, Jeff Thurrell, a partner of Fisher Phillips, and Lynn Mohrfeld, president of California Hotel and Lodging Association, will cover COVID-19 news for the lodging industry and employee law update on bringing your staff back after COVID-19. So first, we will hear from Lynn. Thank you.
Great, thank you, Jessica. I appreciate it. Just so everyone knows, what we'll do this time is I'm going to try and keep it to 45 minutes, and then we will have questions at the end. We're going to try and leave somewhere like 5 to 10 minutes. I'm figuring there may be some employment questions for Jeff at the end, so we'll just do that at the end then. And then a special shout out to Jennifer Floor, CHLA's Senior Vice President. It's her birthday today, so happy birthday, Jennifer, and thanks for handling the questions on it. So today I'm going to just go through my usual factoids, some reopening information, and then talk about a little hotel plan that we have in play for right now before I talk to Jeff. So like last week, I just kind of want to keep you guys apprised of what's going on here. This graphic is from University of Washington. The project is called IHME. I encourage everyone to go look at that website. You can look at international, by state, by country, etc. But anyways, the deaths are remaining kind of stubbornly stable. And that's the bad news, and that's also the good news. They aren't going up like they were in the beginning of April. So we're seeing that. So you can kind of see them going up and down within a band over the last month or so. So this has been pretty stable in terms of where we are in California. And then the pink part and the dotted line on the right-hand side, that's where they expect it to go. So the top of the pink is the worst case scenario, and the bottom is the best case scenario. And of course, the dotted line is in the middle. Next 2 weeks are crucial. I think that we saw more essential travelers than ever, and everybody else was out for the holiday weekend. It was great weather throughout California, so in terms of exposure and kind of people being out and about, I think this past weekend is going to be a crucial test whether our cases and our death rates go up in the state of California. So we're going to need to keep our eye on that. The usual numbers for you in terms of occupancy. I did a little bit differently this time. 4 weeks ending May 23rd, so before the holiday weekend, versus the entire month of April. So you'll see that the occupancy numbers went up just a little bit. We're seeing San Francisco still kind of lagging a little bit, but 25% compared to 19.2. LA had the biggest jump, and then Anaheim as well took a pretty good increase. And then technically, I will encourage everyone to go and look at our homepage or on our site and look for the essential traveler guidance. Those occupancy numbers are technically supposed to be from essential travelers. I think that over the past week or so, we've seen a lot of pent-up demand from residents in California and others that want to travel that may not necessarily be presenting themselves correctly, or could be presenting themselves as essential travelers for hotels and other traffic, beaches, etc. So anyways, just a caution out there. Please pay attention to the guidance we've provided, and make sure that you're abiding by that. All right, so when are we going to open? We still don't have a date. That said, hotels are firmly in leisure travel for hotels is firmly in stage 3, and we've had discussions about revised guidance with the states, the governor's office, and GoBiz, with a little bit of input from public health as well. And so we're negotiating, not negotiating, but coming to the best guidance that we can put out for the industry. We, as the hotel industry, have an advantage. We've been open. We have guidance out there. We've been very proactive along the way, and so we're kind of already doing it. So we positioned ourselves as, hey, we know how to do this. We've been doing it. Let us do it on a regular basis. So this quote that I have up on the screen about theme parks being in stage 3, this is really good news for us. If theme parks are in stage 3, and I would consider them what has been referred to as mass gatherings, leisure travel should be perceived as a lot safer than the mass gatherings, and so that firmly puts us in the stage 3, if not a little before that. I expect this to happen, and this is just the world according to Lynn, within the next couple of weeks. And again, the next 2 weeks are crucial, so this is going to all depend on where the numbers go in the next 2 weeks, but it seems like we're all ready for it. From my discussions at the state level, the counties won't have to do an additional, what they've been referring to as attestation. And it seems like the regionalization approach, where the counties that have attested that they are where they are in terms of testing and hospitalizations, et cetera, they don't have to do anything new to go to stage 3. So it looks like once the state announces that we're at stage 3, counties will be able to act on their own to open leisure travel at that point. So again, I think we're going to see it on a county by county basis, some type of regionalization. And lately we're seeing in the larger counties, we're seeing cities within counties as well. This is especially true down in LA. They've got 88 cities within that county. So some of the cities want to open up a little sooner than the entire county. So seems like we're I wouldn't say that we have any definite news, but I would say that we have positive vibes in terms of when the leisure travel is going to open. And I think it's going to be sooner rather than later, my personal guess. Okay, so, and then finally, before I turn it over to Jeff, part of the reopening on the leisure side is that the state wants everyone to have a worksite specific guidance. And so we've developed a hotel plan. We're in the final checkoffs on this from legal, insurance, and some technical guidance to make sure we get this right. But it's going to have all these things included that are on the screen here. And then we're going to launch this next week as a member benefit. So we'll customize it for everyone's particular hotel. And then send this out, and all the hotels will be covered. It's largely the same as the guidance, with an employee training component to it as well, and also an incident report, so that you can get better at this. Hey, someone was exposed, and here's what we did, and here's what we're going to do to try and prevent this in the future. So look for that probably on Monday afternoon, if everything lines up correctly, and we'll make sure we get to that. So now I'm going to turn it over to Jeff. Jeff Thurrell is a partner in the Irvine office. He's all on employer side, employment law, and he does what I call the big three in California: harassment, retaliation, and discrimination. Is his ballpark. And I've known Jeff and worked with Fisher Phillips for over a decade now through CHLA. They've represented us in some litigation recently in Long Beach and in Oakland. In addition, Jeff is on the CHLA Board of Representatives as our Board of Directors as our counsel as well. So he's a very valuable resource, and I encourage everyone to use the chat feature. Now's your time to get some free legal advice. So with that, Jeff.
Thanks, Lynn. I appreciate it, and I appreciate the invitation to talk about getting back to work. And I tell you that information that Lynn's providing in terms of getting that plan out, it sounds like that's going to be an invaluable resource to make sure you take a look at. And I'll probably touch on a lot of things that might have that Lynn's packet might have a lot of detail on. So, Lynn, if you could kind of click on to the next slide. In terms of where we're at, and I'll go through this quickly because everybody knows we're certainly, we're going back in this phased process or staged process, and there are different triggers that allow businesses to reopen, both non-essential and essential businesses. And so we'll kind of skip phase one. And Len, if you could click to the next slide. We have phase two, which we're sort of in between phase two and obviously phase three. And it's about, sort of opening things back up and getting things back to normal. So you always want to know jurisdictionally, where you're at as a county in terms of what you can do. And that's going to be drastically different from, Monterey County to Los Angeles County to Santa Clara County. And I think everybody's probably pretty aware of that. So I don't want to burn too much of our short, precious time here on that. So Lynn, if you could flip to phase three, and this is obviously what we're hoping for soon. And I actually do sort of echo, Lynn's comments. What happens over the next 2 or 3 weeks is really going to be determinative of how quickly, we can get things, hopefully rolled back and open, certainly for the leisure sector. We can go ahead and flip to the next slide, Lynn. So let's dig in, and what we're going to try to talk about is and touch on is, answering the questions, can you reopen? And really one of the bigger questions is, how do we get prepared for that reopening? And, one of the pitfalls that we're seeing, and I've spent countless hours on the phone over the last month talking to hoteliers and other clients about, how do we bring employees back? Because certainly staffing levels, at least at the get-go, are not going to be the same as they were before, COVID-19 struck. So I want to touch on that a bit as well, and then talk about some of the things that we're going to sense. I sense are going to occur about reluctant employees and how to handle these things and really how to prepare for various issues that are going to arise. And I think the more preparation that really people put into this, certainly the smoother the operations are going to be. And make no mistake, this has not been a smooth process over the last couple of months, as I'm sure everybody can attest to, and it certainly is not going to be a smooth process going forward. But really getting out in front of it, and as everybody knows, I feel like I'm speaking to the choir to a degree. This is a moving target in terms of guidance on a lot of the issues that we're seeing floated around that we'll touch on today. And our advice today might be different tomorrow, depending on what kind of guidance comes out of various local, state, or federal government agencies. So, without any further ado, Lynn, if you could hit the next slide. So let's talk about the plan. And I'm sure people are getting there or have gotten there or pretty close to getting there, but you really want to have, a COVID-19 response team that's in place. And you want to have the right people designated to be part of that team and to make sure that they're, assuming those responsibilities. And then, part and parcel to that team really needs to be taking a long look at, local, state, shutdown orders and to see what they say. And there's obviously a lot of gray in those orders, as we all know, as we sit here today, but you want to make sure that you spend time knowing, what's out there. And then key to this, and it sounds like Lynn's going to have a lot of templates on this, is really preparing policies and protocols, establish written worksite specific plans, for your properties that outline, the social distancing and all those other things. And then one thing that it's not necessarily buried in these slides because of the short amount of time, but you're going to want to make sure you take a look to see, what, if any, of the additional leave laws are going to apply to your business. And if they are going to apply, making sure you have those written policies that you're going to provide to the employees, that you're going to post, and making sure that you have the infrastructure to be able to handle, maintaining those additional sick time policies and the various other things that may or may not apply to your property. So you want to make sure definitely that you're dialed in on these things. I do think it's critical that you have somebody who clearly is in charge of the COVID-19 protocol and policies. That is key. Also, it's pretty critical, and I think Lynn's materials that will come out, and certainly there's a lot on this right now, is when it comes to cleaning and safety, there's a lot out there, and you want to make sure that certainly you're OSHA compliant with regards to the chemicals you're using and the people that are handling those chemicals as well. You're going to want to consider some practical issues, maybe look at dry runs of extra safety protocols and see how they work. And practice typically makes perfect on this, so it's a matter of getting through these things. Next slide, please. So, going through certain things that everybody's going to definitely need to do, and I know we're doing it here in our office at Fisher & Phillips, it's making sure you have the appropriate PPE, such as face masks. One thing that's come up pretty readily in terms of the telephone advice I give to employers on a daily basis is, what exactly do we have to reimburse for? And I certainly think that, if there's a strong likelihood that if you're making employees, wear masks, you're going to want to probably go ahead and reimburse that cost unless you provide them yourself or have masks available yourself. And then, clearly I think everybody's aware of this, but you really want to dial in a written social distancing protocol on the entries and exits and the break rooms and the common areas and all of those types of things, elevators, those types of things. You want to make sure, if you don't have them installed as of yet, make sure that you have hand sanitizer dispensaries across work sites, across the properties, and then make sure, and we've been touching on this, you have certainly a well-established written protocol for cleaning the facility, which will vary depending on what area of the property you're cleaning. I know I have a lot of clients that are spending a heck of a lot of time evaluating workstations, entries, exits, break rooms, restrooms, elevators, and what we're seeing morph is, for elevators, you have a large property that's multi-story and it's not practical to have one person in an elevator. It seems the guidance is, if you can keep 6 feet apart, maybe you put 4 people in an elevator, and it's a bit of a moving target. But those are things that you want to think through all of those issues and not let them just happen. Certainly for break rooms, we're seeing a lot of dividers and things like that. And I will say this, even for hotels, when you have management meetings and other types of meetings, even when everybody's back to work, I think, managing those meetings through Zoom versus trying to have them in a conference room is going to be sort of the gold standard of how you're going to want to do that. Next slide, please. So this is something that I get questioned on regularly 5 times a day, and that is, what's the protocol in my local jurisdiction in terms of mandating temperature checks and mandating wellness checks for my employees? And we'll start sort of from the employee perspective. And the advice and the guidance has been sort of across the board. I suppose the gold standard advice that we give is that you would have a third-party medical professional outside the building that would be intaking employees and doing both the temperature checks and a wellness check where they ask the 6 or 7 questions about various symptoms that might be COVID related to the employees. And then there's a lot in between. A lot of companies seem to be opting to just doing the wellness check and getting an affirmation from the employees that they've taken their temperatures. Some employers are doing just the wellness check itself, and some employers are doing the temperature check and then giving an alert to the employees in a posting saying that if you have these symptoms, don't come to work. So there's a combination of ways, and it's an interesting predicament that everybody's in, because on the one hand, the more intrusive you are, you have this gold standard for prevention, but it's also intrusive on the privacy of the employees, and it's somewhat, certainly to the extent you're taking the temperatures and getting confirmation of wellness checks from guests, it's probably not the most hospitable of things to do. So there's going to be some strategic calls in terms of how aggressive you want to be with these things. And one thing that is super clear is that if you have employees and you're taking temperatures every day, and those folks that test over the 100.6 or whatever the threshold is, are you keeping that in a log? That ends up being considered private information that would trigger some obligations of confidentiality and would trigger a disclosure under the California Consumer Protection Act. So it's super critical that if you're maintaining temperature logs and maintaining daily wellness checks regarding symptoms, that you have an employee needs to be provided with a disclosure. There are different ways you can get those to the employees. The gold standard is to have the employees sign the disclosure. You can post these disclosures, but make sure you check the box on this one, because there's some statutory penalties associated with violation of this privacy law that could add up pretty significantly if you don't have it. So if you're now in the midst of temperature checking and wellness checks, you're going to want to make sure your disclosure is squared away and is adequate, et cetera. Next slide, please. So one thing that Lynn touched on real briefly, and something that you're going to want to have written plans in place, and you're going to want to have some sort of training template. And I don't think it's rocket science when I look at what you have to train people on, but how do you prevent COVID-19? What are the symptoms? Reiterating not to report to work if you're experiencing the symptoms. Taking your temperature, how to wash your hands, how to properly use face coverings, the importance and the requirements of social distancing. All those things are the things that need to be bundled up in the training. I've come to the conclusion that training probably doesn't need to really last more than 15 minutes. And I do say this, and a point to probably take away is you're going to have your employee training for everybody, but the way, and this is pretty critical, and you see it in terms of how the essential workforce is currently managing this, is what happens when you have employees that aren't following these protocols of social distancing and hand washing and these other things. And that's where you really have to train your managers to enforce the policies. And it's pretty critical. I know I've got some HR folks in distribution centers and elsewhere, and they're pretty aggressive about if they see employees that aren't following the social distancing, guidelines, that they step in and disciplining as appropriate, et cetera. So I think you need to add another 5 minutes to 10 minutes to the managers on, it's your responsibility to ensure that this kind of goes off without a hitch. Next slide. Policies and protocols before reopening. You want to make sure that you have clear protocols, but you need to be flexible on the timeline. You want to make sure that you may have temporary policies in place as it relates to remote workers and other things, and you want to make sure that you make sure you state that they are temporary. And one thing that I think is pretty pretty important is your point person, whoever it is, you're going to need to anticipate, employees' complaints and questions, and you're going to want to make sure that you've got some sort of FAQ prepared so you can answer questions that come up from employees. You're going to get a lot of questions about what are you doing about this, and can't we do better? So you're going to need to be pretty careful that you've got that well scripted beforehand so you don't send mixed messages, which could create some issues with the employees. All right, next slide. So let's talk about what I think is one of the real critical issues that employers and hoteliers are going to face, and that is, who do we bring back? And what I get from the majority of my clients, the vast majority of my clients that I've had phone calls with, is, well, Jeff, what we want to do is really bring back our best workers, and that might not necessarily be the folks that have been here the longest, but we want our best moving parts coming back, especially since we're going to come back on somewhat of a skeleton basis probably out of the gate, and certainly in this industry. And I will tell you that there's some pending legislation, and I know Lynn and I talked about it before we started today. There's some local jurisdictions, and there's a pending legislation in the states. You want to make sure you keep your finger on the pulse. That there's a push to try to have a seniority-based recall laws in place, and so you want to make sure that's not there. Assuming there is not a seniority-based recall law in place, then you're really going to want to look at very objective criteria. If you're not using seniority as the main factor in terms of who you're returning, you're going to want to look at who can I bring back successfully, and why do I want to bring these people back? And you don't want to have this left just for your managers. You want to be able to focus your objective criteria based on somebody's skill set, their education. Those are the types of things that you're really going to want to focus. One thing I know a lot of companies are doing is, in terms of the initial go-round as we enter phase 3, is having voluntary. Who wants to come back? And that maybe is sort of round 1. But if you're really trying to pick your best folks out, you're going to want to make sure that you can put your money where your mouth is in terms of why you would bring them back over somebody else. And what you run into, frankly, and where we're going to see, I think, a significant amount of litigation going forward is, an employee who's older, who doesn't get called back, who has, 15 years of seniority, and is somebody who's significantly younger with less seniority, gets called back, and then, the question is going to be, hey, did we not bring this person back because they're older? And the way the employer is going to get out of liability on that is going to be, well, we didn't bring this person back for these specific objective reasons. So that's important. You want to be pretty careful that you look to if somebody needs an accommodation because they have a health issue and that's why they don't want to come back. I wouldn't just put them on the deep 6 list, never to come back. You're going to have some accommodation obligations as well. Okay, next slide, please. I would make sure you come up with a system, and I would make sure that you come up with a spreadsheet that show the demographics of the folks that you're calling back first versus the demographics, age, race, whether they have some sort of medical health condition. You want to have some chart that shows who's coming back and who isn't, and see if things seem a little one-sided. And I would be wary of just allowing the managers to say these are the top 3 people without really putting them to the test, as I said before, as to who is it that's coming back, and the specific reasons as to why you think they're a better candidate for the position. Next. Okay, so shifting gears a little bit, let's try to get your mindset around, how do we prepare for, employees' questions, and what kind of questions do we think, we're going to get? And so when we're looking at it, one of the questions is, can we let some people work from home just to be nice? And the answer is, I think at this time, being flexible and accommodating, depending on what the positions are in the hotel, a lot of that's not going to be practical, but certainly for some of the folks that might be working from home, it might be, you want to be flexible. But you also want to have some sort of consistency with it as well. And so you got to be a little bit careful if you've got, 2 salespeople you're letting work from home, and then 3 that you're mandating come in. You're going to want to make sure you had some reason and criteria as to why you were making those choices. Next slide. So, one of the issues that comes up is, and I'll sort of speak about this broadly. The quote on the slide there, I don't feel safe working in the office. I don't feel safe coming back to the hotel. Is that a situation where the employer can then say, well, you don't feel safe, so we're just going to go ahead and terminate your employment? And our advice has been, not to do that, is to probably keep them on an unpaid leave of absence to the extent you could, versus hauling off and terminating them, at least in the near term on that. And part of the reason on that is because you have situations where, if an employee reasonably believes that they might, be in danger coming to their workplace, and you terminate them for refusing to come in, you can end up seeing a lawsuit over it. And so my take is, you're better off probably holding those folks out for at least for a little bit before you go ahead and terminate them. In terms of folks where you have accommodations that might come up, one thing in California, and it's a quirky California sort of centric issue, is there's a couple of cases that came out talking about what they call associational disability discrimination. And it kind of goes like this. I have a family member who has cancer, and I'm missing, I have to take care of them for 6 months. And the question is, does the company, aside from FMLA obligations, above and beyond that, does the company have an obligation to try to accommodate that employee who's taking care of somebody who is disabled? And the way California courts seem to be coming down on that is you do have that burden. So if you have an employee who says, I've got, a family member I'm living with who, needs care, and something along those lines, you might have some legal obligations to accommodate. So be mindful of that. All right, next slide. Phased returns to work. I mean, this is kind of reiterating what we said before in terms of, people coming back, limited work from home to the extent practical in this industry, probably not too much. And then really having, phased returns to work, limiting exposures that employees, might have. So those are some of the things that you need to be ready for. Okay, next slide. All right, so let's talk about really what we're going to sense happening when employees come back. And that is, some employees are certainly going to be very happy to be back at work. Other employees are going to be very skeptical. Some employees are going to, look for reasons to be sent home, paint the workplace as unsafe, and you're going to have to be prepared to deal with these issues. And I think transparency, really, in having a plan to say out of the gate, we're committed to safety, and these are all the things that we're doing, is pretty critical. And I think that on that COVID-19 team that you have, I think it's pretty critical that you actually put some hourly folks that you've recalled back onto that committee and make sure that they have a voice in what's happening and can share some of the issues that are going on, and make sure you have a pretty strong lifeline going back and forth in terms of allowing employees to provide guidance to where the workplace can be safer. And I think that's certainly one of the key takeaways that I would have on that. Okay, next slide. I think one of the things that I had mentioned this before is have a safety committee or allow an employee to be on that COVID-19 team. I think that's pretty critical, and make sure that you're communicating with employees on a regular basis and reiterate all the safety protocol that are in place. And I think that will probably put a lot of people at ease. I mean, one thing that I've heard, and I know Lynn and I talked about this earlier, is that, you know, most of the employers that are having their employees have their temperature taken and are doing the health check questionnaires coming in are somewhat appreciative of it. And so the pushback has not been, and maybe this will change, but the pushback has not been as aggressive as I frankly thought it was going to be. All right, next slide. One thing that's, I think, super important to point out is there are all sorts of, you know, real highly technical wage and hour violation type issues that come up when we're dealing with situations where, you know, we've had people that are working a lot less, or we want to reward people who are coming in and providing you know, extra service during what would be considered a dangerous time. And, you know, we've probably seen in the papers, you know, numerous employers that have given, you know, sort of bonuses across the board to all of their employees for working, kind of hazard pay sort of thing. And it's really, really critical that you pay attention to that, because if they're hourly employees and you're giving them bonuses for working for hazard pay or, you know, extra credit pay, you're going to want to roll that into their overtime rate. And if you don't, there are all sorts of penalties and other things that trigger. One other, you know, cautionary reminder is that you might have employees that are not entitled to overtime because you have them categorized as exempt, and they need to make twice minimum wage times 40, you know, right around, I think, $50,000, a little bit more a year. And if they go under that threshold number, you know, they're going to be entitled to overtime. So if we've had reductions in pay, which obviously across the board, it seems like there have been reductions in pay, you need to make sure you're still hitting those thresholds, and you need to make sure you're not, quote, docking. It's okay to say you're going forward, your salary is going to be 10% less, but you don't want to dock pay and say, well, you're just not going to work one day a week, and we're gonna take you know, we're going to take 20% of your pay out because we're going to have you work one less day a week. You don't want to do that with exempt employees, because if they work any part of the week, they're entitled to their whole salary. And a bit of this is semantics, but if you're going to do a wage reduction, you just want to do you know, haul off and just do a salary reduction. Okay, next issue, next slide. Last thing is, if you do have, you know, some of the executives and sales folks working at home, make sure that you've got, you know, safety protocol as it relates to, you know, customer confidential information, all those other things, and just sort of dot the I's and cross the T's on that. I know a lot of people scrambled out with the laptop, and the security that is probably out there is not what it normally would be when you'd have a remote worker. I think that, let's see, next slide.
That's it.
I think that sort of wraps it up. So Lynn, did you have anything to add on that?
No, very well done. And I think that the temperature checks, just like you said, are probably one of the biggest issues that we're hearing about, and how we're doing that. And we haven't heard a whole lot on the guest side, but I know that some of the national companies are talking about temperature checks of everywhere but California, and that may give everyone a perspective in terms of doing this within the state.
Yeah, and I think that has a lot to do with the privacy issues in California that are highlighted, you know, so yeah. We'll see.
Okay. Jennifer, birthday girl, do we have any questions for Jeff?
Yes, we have quite a few questions for Jeff. Thank you for the birthday wishes, everyone. And if you do have questions, please put them in the toolbar to the right of the screen. So Jeff, in terms of the temperature checks, just they want to know what the requirements are for keeping that information, and does CHLA require they keep records?
No, they don't. So there's no requirement that you would keep those records, and it's an interesting thing, because on the one hand, if you don't keep the records, it's not necessarily confidential private information under California's Privacy Act. I think the general recommendation that we've had is that you're not writing down everybody's temperature as they come in, except if Bill Smith comes in at a 102, you're probably going to log that out, because you're going to want to manage that, and you're going to want to make sure you have protocol in place to make sure that before Bill Smith comes back on, I forgot what the standard was to be temperature free, but I think it's a couple days before you would allow Bill Smith to come back in. So I think in terms of logging it, I think the recommendation is to log those employees probably that have the higher degree of temperatures. And part of the reason you're doing this is because, we're going to get some horrendous work comp claims. They're going to come in California. And Governor Newsom, signed a bill that essentially said it's going to be a rebuttable presumption that if you make an employee come to work and they catch the coronavirus, it's going to be a rebuttable presumption that it was a workplace causation. And so, making sure you follow these processes is going to prevent having what's called a serious and willful, meaning that you're doing everything you can as an employer to ensure the safety. And so otherwise you would end up getting what's called a serious and willful claim, where they could get enhanced penalties by alleging that the employer was, grossly negligent in terms of looking at the safety. Could also probably trigger, I know there's been a bunch of articles and other things written about wrongful death claims from customers or vendors or things like that. So having that protocol in place, showing that you're following up and not letting Bill Smith come back right away if he has a temperature is important. So I would log that. Sorry for the long-winded lawyer answer. And happy birthday, Jennifer.
Oh, thank you, Jeff. Is it okay to allow one shift to take another person's temperature, like, as one's coming in and one's leaving? Is it, or do you recommend a specific person, like an HR person, take the temperature?
Yeah, so it's a good question, and it's come up a lot. And one of the reasons why we don't recommend having one person take the temperature who's like a line employee or a lead or something like that is there's sort of privacy issues. Well, not sort of, there are privacy issues. And let's say someone pops a fever and we've got, an hourly non-manager employee or a real low-level manager who knows that, it's kind of, giving that person maybe more information than we would want to give them. So that might not be feasible, depending on, when these shifts split. I know I have one client that, it's a manufacturing client, and they've got shifts coming in at 3 o'clock in the morning. And, I essentially got yelled at pretty aggressively by the HR person when I said, well, it might be you just put HR out there or hire a third party to do it. So you have to work with what you have, but the standard really would be to try to have somebody, if it's a robust, large company, you'd probably want to have, HR, third party, aside from that, if it's mid-size or smaller, you're probably going to want to have, somebody who you would be considered, sort of a confidant, higher level manager do it to the extent you could.
Okay, and Jeff, what do you recommend in terms of taking temperatures on guests when they arrive?
Well, I'm kind of, and Lynn and I have talked about this over the last few days. I'll give you the lawyer answer, and then I'll give you the Jeff Thurrell answer. The lawyer answer is, to the extent you can, it's probably not a bad practice based on the way I sort of am seeing the guidance coming out, but I don't necessarily see it as a requirement. And I think that if you have the posting saying, we don't want to have you enter if you have any of these symptoms, I probably would opt for the second. And, without having firm guidance saying you have to do this, which may come, but currently it's not there. I probably would opt to be a little more aggressive until the guidance becomes clear that it's something that you really have to do. I mean, the downside to not doing it, or the upside to not doing it is that you're probably going to have happier customers that come in because, who wants to have their temperature shaken? The downside to not doing it and following that protocol is that you might have some customers that said, hey, I feel like they're not taking this as seriously as they should. And then secondarily, you might have somebody challenge your processes. And if you had somebody get sick, you could end up with, some sort of litigation over it. So I guess all things being equal, I probably on the conservative Jeff side of things would say, to the extent we can make this as painless as possible, maybe you do the temperatures, but I think it's kind of up in the air. And I think to Lynn's point, I think seeing what some of the big flags are doing and seeing how they're treating it, I think it's important to watch. And Lynn, I feel free to weigh in on that as well, because I know you've looked at the issue pretty ad nauseum as well.
So there's been a lot of discussion about who does the temperature checks. If you're going to do guest temperature checks, is that your employer out there? And what happens when you have a night auditor on, and who does that? So I think probably a lot of people on this webinar have seen the St. Regis in New York, where they have registered nurses out front taking everyone's temperature. So I've seen that approach being discussed. I don't know anyone else that's doing it, but there's a lot of people saying, hey, let's put like a third-party kind of healthcare professional out there to do that, so we keep any kind of temperature checking one step away from our employees. And then the only other place that I've heard it discussed, and it's not applicable just yet, is for meetings. So if you're going to be in close proximity to people for a while, or even physically distancing at 6 feet for a length of time longer than 15 minutes, do we want to do temperature checks for specific meetings? And I've heard of meeting planners asking the hotels for that as well. It's come up on weddings too, where they say, hey, everyone has to get their temperature checked before they get into the wedding. So more from a customer perspective on that level than from a hotel level.
I think it's a really good point, Lynn, in terms of that might be one where you really want to have the third party out there. I mean, if you can afford it, depends on the size of the property and how realistic it is, but yeah, probably easier pill to swallow, I think.
Right, let's try to get through a couple more, Jeff, if you're up for it. Someone's asking if you could repeat the part about exempt employees. If they work reduced hours, are they still entitled to the full salary?
So here's, and I didn't mean to get marble-mouthed on that. So it goes like this. You can take an exempt employee and say, look, the next work week that you have, let's say you have an exempt employee, and the example is they make $100,000. And they say, starting in the next, really you want to give a full pay period's notice when you're going to change their pay. So you say, starting in the next pay period, we're going to give you a 10% reduction in salary. So your salary is going to be $90,000. That's fine. I'd put it in writing so there's no miscommunication. I would handle it like that. That's different than if you say, look, we're going to deduct 20% of your salary this week and furlough you so you're only working 4 days a week. There's a distinction there, because as an exempt employee, if you work any day of the week, so to be on the safe side, if you have exempt employees, and you may allow them to work somewhat reduced hours, but you're going to want to say, we're reducing your salary to this, and here's what your job responsibilities are. So you got to be careful, because I've had a couple clients that haven't quite messaged it right. And California is a place of technical violations on the wage hour front, that if you don't, sometimes, it's how you phrase something is, and so this is one of those issues where I've had a few clients that haven't quite phrased things correctly, and it looks like more of a takeaway versus, hey, going forward, this is what your salary is. And you might end up working 7 days a week, you might work 4 days a week, you might work 3 days a week, and they might work less. So hopefully that answers that question.
Great, thank you, Jeff. One more. How do you identify a COVID team if you have a very small team of people? Do you have any hints on that?
Well, I mean, I think for sure, to the extent, and small team is relative, I mean, to the extent you have a human resource department, you're going to want to make sure that somebody at the highest level of the human resource department is part of that team for certain. And to the extent you have a risk department, you're going to want to make sure that the highest person in the risk department is part of that team. Now, obviously, there are different layers, and there are a lot of properties that don't necessarily have those levels, and you might be left with, and the spectrum is obviously very wide, but you might be left with the general manager and the department heads, and that might be the COVID team that's present. So it really just depends on the on the bandwidth of the property in terms of how you'd want to do it, and it would vary dramatically. But I guess the message would be this team needs to be the highest level of competency you can put together, for sure.
Excellent. Hey, thank you very much, Jeff. Thank you, Jennifer and Jessica as well. And thanks everyone for attending. I hope these are educational and advantageous for you to attend and spend some time on. I know that we're all busy right now, so Appreciate your efforts, and thanks for your support of the California Hotel and Lodging Association. Be well.